Hello everyone, you're watching sqadia.com and I am Hammad Haider. As you know that nowadays there's actually increased rise in the epidemiology of tumors, especially the cancers such as breast cancer, lung cancer. There has been a huge and tremendous amount of increase in these cases. And similarly, they're putting a lot of burden on the health system as well in almost all of the countries. Same is case with the bone tumors as well. They are more malignant, they're highly lethal, and they can be a death causing as well. Especially when we're talking about Ewing sarcoma or osteosarcoma, these are predominantly malignant tumors of the children. So that is why it's very important to know what are these and how to deal with them. And today we'll be going through those as well. So in the first section, we'll be going through the primary malignant tumors such as Ewing sarcoma and multiple myeloma. Ewing sarcoma is the third most common tumor between age of 5 to 25 years and the most common in age less than 10 years. And when we are dealing with hematogenous tumors, the most common tumor which is spread by hematogenous route is multiple myeloma. Although the age is slightly different, it usually occurs in the old age around in 50s and 60s. Similarly, we'll be going through the primary lymphoma of bone, chordoma and adamantinoma, which are also chordoma and adamantinoma are very lethal malignant conditions. In the second section, we'll be going through another most important malignant condition known as osteosarcoma and chondrosarcoma. We'll be going through the epidemiology, their presence, and how they actually present in the children, and what are the treatment options available for chondrosarcoma and osteosarcoma. In the third section, we'll be going through the fibrous and synovial tumors such as fibrous, different as fibrosarcoma as well. We'll be briefly touching upon the vascular tumors as well. Some of them are benign such as the mesenchymal, while others are highly malignant although rare such as angiosarcoma. And in the last section, we'll be going through the lipomatous lesions such as lipoma, which is a benign tumor, and liposarcoma, which is a malignant variety of the lipoma. And lastly, we're going through the metastatic disease of the bone. Can other tumors, for example, from kidney, thyroid, breast, lung, and prostate, can present in bone? Yes, they do. And usually they present in the lytic lesions or plastic lesions, the long bones, or in the spine. And we will be briefly going through how to diagnose what is the type of a lesion, and then how to proceed with the workup and eventually leading to biopsy and how to deal with these diseases. Thank you very much. Keep watching sqadia.com.